So we have other conditions that can affect, for example, chlamydia. That is basically a bacterial infection, sexually transmitted. So which cause urethritis in the male. And then gonorrhea also is a sexually transmitted infection, is a bacterial infection. It causes suppurative, that is basically in gonorrhea, you tend to have pus coming out of the urethra. That's what we mean by suppurative urethritis. Syphilis also, as we have already said, can affect AIDS, HIV, and acquired immune deficiency syndrome, HIV. Hepatitis B infection also can infect the male genital organs. Genital herpes, which is also a sexually transmitted infection, can affect the genital area. Of course, we can have what we call cryptorchidism, which is basically undescended testes. So here you are supposed to remind yourself about, embryology, the way the testes will descend, so that at birth, usually it will be within the scrotum. So if it fails to be within the scrotum, that's what we call undescended testes. So we call it cryptorchidism. And you can, of course, do surgery. And it can be anywhere. You do an ultrasound to locate where it is. It could be within the abdomen. It could have failed to form. Of course, that one will be agenesis. But if it is undescended testes, you will be able to see either in the abdomen or in the inguinal region, but it will not be. The scrotum will be empty. Most of the time, it tends to be one, and usually more common on the right than the left. And then, of course, hydrocele, as we have already said, accumulation of fluid within tunica vaginalis, that potential space between the scrotum and the testis. So accumulation, it could be congenital. That means a child could be with a processus vaginalis. I think we talked about it last time, where fluid from the peritoneal fluid comes in. But in adults, most of the time, it tends to be caused by infection and many other causes. Prostatitis is infection of the prostate. So infection of the prostate, prostatitis. In younger people tend to be sexually transmitted, caused by sexually transmitted infection. In older men, it may be because of obstruction of the prostate, because of enlarged prostate. The urethra is blocked, and so they tend to be, the urine become infected, and it may cause prostatitis, and even may go ahead and cause epididymochitis that we have talked about. So prostatitis. And of course, that one is treated, prostatitis can be treated with antibiotics. Then looking at male infertility, last time we looked at female infertility, and we said almost contribution to infertility in a couple who are married would be almost equally the same. We talked about 20% to 30% in male, and 20 to 35% in female. So basically almost 50-50. So also for the male, when there is infertility, you need to investigate. And I think we talked about the investigation mainly for male. Investigation will be semen analysis. So you take semen where you look at the volume, and the volume mostly will be 2 ml to 5 ml. That should be the normal volume. And then, of course, you look at the quality of the spermatozoa. You can find that spermatozoa, they are abnormal, maybe dwarfs, maybe giants, maybe bicephalic, that is has 2 heads. It may be bicaudal, it has 2 tails. That is the abnormal. Such sperm will not be able to fertilize. Or the number of sperm may be very little. I think we talked about last time, in one ejaculate should be even up to 500 million or more. So if it is less, we call it oligospermia. If there is no sperms completely, you say it is azoospermia. So we do what we call semen analysis. You look at all those cells. So it may be also be caused by endocrine disorders. For example, if somebody is not producing enough testosterone, then those will be endocrine disorders. Then the sperms will not be formed as they should. If the different duct is blocked, so although the sperms will be produced, that they will not be able to come out because the that duct that brings it is blocked. You can also have failure of erection. So if there is no erection, there will be no penetration. So you will not have sperms or semen deposited in the vagina. And of course, if there is no ejaculation during sexual intercourse, then they may likely to be in infertility. Vasectomy, we talked about if you are to cut the vas difference, in which you have to do bilateral. And when you cut them and you tie them, then the sperms, basically the rod will be blocked. and they will not have a way of coming out. So you're likely to develop infertility. So you can have other things that suppress spermatogenesis. For example, ionizing radiation. So usually when we do radiation, we don't want to do unnecessary radiation like CT scan of around there, radiations, and so on. That in itself can suppress spermatogenesis. Even chemotherapy treatment for cancer can suppress spermatogenesis. And the other drugs, that when you look at the drugs, even as you move on to continue learning more about the drugs, they'll tell you these drugs, out of the side effects, they'll tell you contraindicated, for example, in this age group, and so on, because some of them can cause that problem and may end up in male infertility.